You know, healthcare is a lot of things to a lot of people. It's the argument between a right and a privilege. It's the dent in our paychecks or the debt we may never be able to pay off.
But above all, it's the one thing you never want to be without when it's your turn to get sick. And today, Governor Jared Polis issued an executive order creating an office devoted to reducing the cost of hospital stays and lowering the price of prescription drugs. His plan is one of many right now, trying to make the system work better for more Coloradans.
And tonight, Denver 7's Jennifer Kovaleski goes 360 on healthcare, its problems, and its many possible solutions.
There's a great divide in Colorado. This line represents more than just the direction of water flowing to the west and to the east. It determines whether you pay a little or a lot for health insurance. Call the Mile High City home. You have several insurance options. Say you live in the high country. Well, you have limited options. 14 counties have just one insurer to choose from, and you pay more. In some cases, we're talking as much as another mortgage payment. Tonight, we rip off the Band-Aid and go 360 for 4 different perspectives on making healthcare affordable, no matter where you live, starting with lawmakers.
We're the epicenter of the most expensive prices in the entire country.
In her 7 mountain communities, Democratic State Senator Carrie Donovan says healthcare is out of reach for too many.
A couple that I met in El Jabal were debating which one was healthier because only one of them was going to be able to afford to get insurance.
Donovan sees one solution as a state-backed public health care option. Simply put, this isn't government-provided health insurance, just another plan Coloradans can buy. Donovan is sponsoring 2 bills to make it happen.
We're hoping that this bill ultimately is an option for everyone on that individual market across all of Colorado.
Representative Dylan Roberts is the House sponsor.
What we're looking to do is create a new, affordable, and competitive option in the state of Colorado that will be available to people when they're purchasing health insurance.
The Senate bill creates a pilot program allowing people living in the highest cost areas, mainly on the western slope, to buy state-backed insurance. Again, that proposal is kind of a trial run. Try it for a year and study the results before developing a new statewide plan. The House bill is much more aggressive. It goes one step further. Lawmakers would use the information learned from the pilot program to develop a state-backed insurance option that anyone could choose, just like state employees can do.
Too many other counties where there's very limited options that the prices of which just keep going up and up and up.
Democratic lawmakers view this as a simple lesson in economics. More competition means lower prices.
Try and put some more competition in the market so that everybody's plans start to lower in cost.
Republican State Senator Jim Smallwood has a different opinion. He doesn't see the government as the solution and worries about the state competing with private insurance companies.
Cost everything.
Having sort of the referees be one of the players would seem unfair in any sport.
His viewpoint: both bills do nothing to address the high cost of medical care and could increase health insurance premiums for state employees.
My fear of allowing other people onto the state of Colorado's plan is that it's going to raise the cost for those who are already covered under the state of Colorado.
To which Donovan fires back.
If there is some indication that that's a reality and not just a rhetorical talking point, that's something that we can still address within the capacity of the bill.
So let's take this 360, 180, and get perspectives from healthcare experts.
Good recent data.
Adam Fox with the Colorado Consumer Health Initiative likes the idea of a state-run plan, and he backs both bills.
It's time for the state of Colorado to really look at creating new health coverage options.
Fox says it's time for the state to step in and force private insurance companies to lower premiums for Coloradans or lose business.
They aren't doing enough to hold down healthcare costs. So they've had their chance. So it's time for the state to step up the game.
Linda Gorman is the director of the Healthcare Policy Center for the Independence Institute, basically a libertarian think tank in Denver. She disagrees with Fox and sides more with Senator Smallwood. She says anyone who believes that having the government run healthcare will make things better for patients cannot have paid close attention to what is happening at the VA. Gorman says no matter your perspective on how to fix healthcare, just about everyone agrees that the cost has to come down.
I think anybody who pays for health insurance or health care would like to see moves that help bring affordability into the conversation.
Bringing this full circle, both sides seem to agree our healthcare system needs an overhaul. What they don't agree on are the solutions.
It has to be the year to get something done.
But with Democrats taking control in both the state House and Senate for the first time in decades, many say this year could be the game changer for healthcare reform at the Capitol. Jennifer Kovaleski, Denver 7.